Do you sometimes feel like your body bruises really easily, even if you didn't bump into anything hard? Or maybe you've noticed that after a dental procedure or surgery, the bleeding just won't stop easily. Well, if that sounds familiar, it might be due to a rare condition called Hemophilia C, also known as Factor XI Deficiency. But don't worry, it's not like the more common forms of hemophilia. This one is sneaky because many people don't show serious symptoms until they face surgery, dental work, or an injury. So think of your blood like a team. If one player, Factor XI, isn't doing their job, the clotting process gets delayed. It's not that the clot never forms, it just takes too long. That's Hemophilia C in a nutshell, a quiet but important glitch in your blood's ability to seal up wounds properly. So what causes this glitch? Imagine your body is a factory that builds proteins to help your blood clot. One of these proteins is called Factor XI. Now in Hemophilia C, the factory either makes a broken version of Factor XI or not enough of it. This happens because of a typo in your DNA, a mutation in the F11 gene that you usually inherit from one or both parents. It's like getting a manual with a missing page. No matter how hard the workers try, they can't follow the full instructions. If both your parents carry this glitch, your chance of having the condition goes up. But here's the twist: even if you inherit it, you might never notice. That's why it's sometimes called a silent deficiency. You only find out when something like surgery happens. Fun fact, it's most common in people of Ashkenazi Jewish descent. Kind of like certain family traits, only this one's hidden in your blood. Now let's talk about signs. Have you ever had your tooth pulled and the bleeding didn't stop for hours? Or maybe after a minor cut, the wound seemed to wake up and start bleeding again the next day. These could be red flags for Hemophilia C. Unlike other bleeding disorders, people with this condition often don't bleed all the time. The trouble usually pops up during or after trauma surgery or dental work. Nosebleeds that won't quit, heavy menstrual periods in women, or blood in the urine after injury are also common clues. But guess what? Some people go their whole lives without any symptoms. That's like having a cracked phone screen that only glitches when it rains. So if you've had strange bleeding episodes in these situations, it's worth asking your doctor, could this be Factor XI Deficiency? How do doctors figure this out? Picture this: you go to the doctor after having too much bleeding after a wisdom tooth removal. They don't just guess, they run smart tests. First, a blood test called activated partial thromboplastin time, or APTT, might show your blood is slow to clot. Then, they'll run a special test to measure how much Factor XI is in your blood. Low levels, hello, diagnosis. Now, treatment isn't about daily pills. It's mostly about staying safe. Before surgeries or dental work, doctors might give you a plasma-derived Factor XI concentrate, which is a blood product that adds the missing protein, or a medicine called antifibrinolytics, like tranexamic acid, that helps clots stay strong. Think of it like using extra tape when fixing a fragile box, just to make sure it holds. But there's a catch: giving too much Factor XI can raise the risk of blood clots, so doctors have to be super careful. Treatment is personalized, like a safety plan made just for you. Can we prevent it? Well, we can't rewrite DNA yet, but we can be smart. If you have a family history of strange bleeding, talk to a doctor before surgeries or having kids. Genetic counseling is like a family health detective session. It helps you understand your risks. Women who carry the gene can get tested before pregnancy. And if you're diagnosed, always carry a medical alert card that says, "I have Factor XI deficiency, risk of bleeding during surgery." That way, if you're in an accident and can't speak, your medical team knows what to do. Prevention is all about awareness and preparation, kind of like wearing a seatbelt. You hope you won't need it, but you're glad it's there when you do. Now the exciting part: what's new? Scientists are working hard. Right now, researchers are testing safer, lab-made Factor XI products that don't come from human plasma. Why? Because using lab-made versions lowers the risk of infections and supply problems. Some teams are even exploring gene therapy, fixing the broken gene so your body can make normal factor 11 all by itself. Imagine a one-time treatment that fixes the factory's manual forever. Also, new drugs that target factor 11 are being studied not only to treat deficiency, but also to prevent blood clots in other diseases. How cool is that? It's like turning a weakness into a strength. While these advances aren't widely available yet, they're giving hope for better,